Hello good people, welcome back to Community Medicine, a channel I discuss matters health. Thank you very much for the support that you've continuously shown me, and if you're yet to subscribe, what are you waiting for? Kindly hit on the subscription button, and you can also help me to like and to share these videos. So today we are going to talk about vaginal candidiasis. Stay with me. So this is a yeast infection that is normally caused by a type or a species of yeast that we normally refer to as Candida albicans. And yeast are actually fungus that are found on our skin, on the mucous membranes, and even on the vaginas. So our vaginas do have a mixed balance of healthy bacteria and yeast, and as long as there is balance of these two, one would not have any issue. But in case there is an overgrowth of these Candida albicans, then one would end up developing vaginal candidiasis. So these healthy bacteria that we're talking about are called lactobacilli. So lactobacilli actually ensure that there is a healthy balance or prevent an overgrowth of these Candida albicans. And our immune systems also normally prevent overgrowth of these yeast. So anything that would interfere with our immune systems, anything that would interfere with the lactobacilli would definitely lead to an overgrowth of these Candida albicans. So what are some of these factors that would lead to an overgrowth of these Candida albicans? So frequent use of antibiotics or antibiotics, depending on how you normally pronounce it, would lead to destruction or killing of both the disease-causing bacteria as well as the lactobacilli, which we said are the healthy bacteria. And then use of irritating perfumed soaps and body splashes to clean the vaginal area would also end up leading to the destruction or damage of the lactobacilli. And then having a weak immune system, maybe due to chronic conditions like HIV/AIDS, individuals who normally undergo chemotherapy due to various types of cancers would also have a weak immune system, which also puts one at a risk of developing vaginal candidiasis due to the overgrowth of the Candida albicans. Then hormonal imbalance. So with hormonal imbalance, you may find that there is one has high levels of estrogen, and estrogen actually creates a very good environment for multiplication of these yeasts. And then individuals who normally douching is actually cleaning the inside of the vagina, which is not necessary because there's a way the body works to clean the inside of the vagina. So douching would also lead to damage or destruction of the lactobacilli. Another thing is pregnancy. So when one is pregnant, you may find that they may have hormonal imbalance, and they may also experience a weak immune system, and this puts them at a risk of acquiring vaginal candidiasis or developing vaginal candidiasis. And then we have individuals who normally put on moist, wet, or damp innerwears. This also creates a very good environment for multiplication of these Candida albicans. We have poor hygienic practices, for example, cleaning ourselves, that is for the ladies, cleaning ourselves from back to front after passing a bowel movement. This is not advisable because it would end up introducing bacteria or yeast which could be on the anal region to the vaginal area. And then women with poorly controlled diabetes. Women with poorly controlled diabetes would have high levels of glucose in the bloodstream and even in the body tissues, and these would also encourage multiplication of the yeast. So how does vaginal candidiasis present? So one of the most common symptoms is genital itchiness, which is actually very intense. So you may find that one wants to scratch themselves all the time because in order to be able to ease this burning sensation. And then we have vaginal discharge, which is whitish, curd-like, meaning that it looks like yogurt, and it's also odorless or has no smell. And this actually differentiates vaginal candidiasis from other sexually transmitted infections, because most sexually transmitted infections do present with the foul-smelling vaginal discharge. Another thing is pain while passing urine, and this could be due to formation of tears or fissures on the vulva area or the outside of the vaginal area due to the intense scratching. And then we have redness and swelling of the vulva area, and you also have pain while having intercourse, which is what we normally refer to as dyspareunia. So what can one do to avoid recurrent vaginal candidiasis? By the way, 3 out of every 4 women will end up developing vaginal candidiasis at some point in their lives. And remember that vaginal candidiasis is actually not sexually transmitted. So what can we do to avoid developing these infections? So in case you're diabetic, make sure that your sugar levels are well controlled through diet, taking your medications, exercising, and then avoid wearing damp or wet innerwears, and then avoid the unnecessary use of antibiotics. Make sure that your immune system is on check by eating fresh fruits, vegetables, grains, and also exercising and drinking plenty of water. So in case you experience those symptoms that we've talked about, don't shy away from visiting the hospital. Make sure that you're treated to avoid recurrence and to avoid recurrence of this infection. Go to a hospital, go to a chemist, go to a pharmacy, and seek medical assistance. Thank you very much for your time. I hope the video was informative. Kindly don't forget to subscribe, to like, and to share this video. Thank you very much, and bye bye.